Hey everybody, it's Kevin and Donna from RPH Ally and our special guest Sylvia here to join us. We're going to go into an interesting discussion. There's lots of folks out there that are doing things in the advocacy space that I really respect. Sylvia has an awesome story of how she got into the advocacy world, and she's going to give us some updates on what she's experienced so far now as a business owner and trying to help patients out along the way. I'm going to hit the reel and we'll be right back. Donna, so good to see you. And Sylvia, welcome. It's so good to have you here.
Thank you. Thank you for having me.
Donna, how did you meet Sylvia?
So we met on LinkedIn, right? This was awesome. Mm-hmm. And it was just kind of like a nice conversations that we've had together. And Sylvia reaching out to me going, your book is so important, which made me so happy, of course. But, just saying that she's in the advocacy space and how many people could benefit from this, and especially other advocates. So communications kind of ensued for a little while, Sylvia. And then it was just like, hey, let's talk some. And we did. And then we try to involve each other with various things here and there. So I was very excited to ask Sylvia to be a part of this and just learn a bit about advocacy, but not necessarily from a pharmacy advocate, which we know that we have some with us. We have some great ones at RPH Ally, but we wanted to make certain that, we talk about and with folks that are trying to get pharmacists involved too from their end because they understand the importance of it. So I just wanted to thank you, Sylvia, for being a part of that with me.
Thank you so much. And I will say when I first saw your book was released on LinkedIn, I was absolutely thrilled. Both my parents, I was an advocate for both my parents many years ago, and my mother was a nurse, a retired nurse. And so she would have been thrilled about this book because I just was like, this is so needed. We have so many people who, because of our fragmented healthcare system, every specialist is focused on that one organ system. And, they don't have time, and that's not their expertise to understand interactions between medications. If somebody is on multiple medications for different reasons from different organ systems, that's not their expertise. So this is just anyone who touches a patient, whether it's on the clinical side or in assisted living facility, should have a copy of this book, MedStrong. It's just a great book. Great reason. It's a fabulous resource.
Thank you. Thank you so much, Sylvia. Appreciate that.
Amen.
And then you're an advocate too. As we all know, we've all been advocates for somebody either we love or somebody who has hired us, right?
Yeah, so true. So Sylvia, let's hear a little bit more about that. How did you get into this interesting advocacy world?
Absolutely, Kevin. So again, I was an advocate for both my parents years ago. My father was a 5-year survivor of pancreatic cancer. That's when I first started researching back in the early days of the internet on the Johns Hopkins board. But then later, back in 2006, I became mysteriously ill. Ran from doctor to doctor in Florida and Georgia, saw over 23 doctors in 2 states before I self-diagnosed and confirmed with a highly specialized test panel that I had Lyme disease. And so I thought nobody should have to go this, 5 years and suffering and everything. And so that became my driving force to start my independent patient advocate practice, because we have so many people who have a complex illness. And, again, they're like me, they're trying to figure it out. And they might be on multiple medications, but no one's gotten to the root cause of the problem. And so that was kind of my driving force.
Wow. And so with that, you had several, I think driving forces is a perfect word to push you into this space. What made you make the decision to go from, I'm doing this for myself, I'm doing this for my loved ones, I'm almost forced to do this to a certain extent, going, I should do this for other people? Like, what was the call that you felt?
Well, I really felt it was actually a God call. I really felt that it was. I actually considered it back in 2015, 16. And actually had prayed on it. And I felt that, there's so many people, because I had helped individuals for probably, this was after I got my Lyme diagnosis for 10 years as I continued to work on my own puzzle, because it was much more than Lyme. But I felt like, there are just so many people out there who are not getting answers. And that's why I was like, I really feel this is needed. And again, I prayed on it, and then I came back around during COVID, and I said, you know what? I think God's talking to you, and I think you need to move forward. And that's how I felt that strongly about it.
Wow, awesome! That's so incredible to hear. And I think so. With that, those very strong convictions in the space, educate us a little bit more on what you've done in the space, especially related to Donna and I's world in the pharmacy space. How have you worked through all of the hoops and all the frustrations, and how pharmacists played a role in what you've been doing?
Yeah. So going back to when I was sick and got my original Lyme diagnosis, and was seeing a specialist in New York, because I was so reactive, I didn't know at the time I had mast cell activation, but years later discovered that was what was going on. But so I relied heavily upon compounding pharmacists because I had to have medications compounded. And there are so many people out there who whether they have an allergy or whether they have mast cell, so I would always talk to my compounder, and it wasn't like, okay, it's going to be compounding meaning that there's no preservatives, there's no gluten, there's no dairy, it might be a veggie cap instead of a bovine cap. But really I have an in-depth conversation because that's how sensitive I was. So that was when I really started relying, even though I did rely for my parents, and did uncover at least one major error in my mother's situation. But that's when I really became more involved with the compounders. But I still rely upon a conventional pharmacist as well. I think that they play a key role because like we talked earlier, that the doctors, they're not trained on this. They don't have time for it, and they're just not trained on it. So I think that the pharmacist plays such a critical role in being able to help the patient understand if their interactions, that's just so key to prevent unnecessary hospitalization. Because so many people are hospitalized because they don't realize that their medications have interactions going on.
Donna, any follow-ups of that piece right there? Folks being hospitalized because they don't realize the medications are on or the interactions of those meds?
Yeah, I mean, that's such a huge problem. And of course, we know that, especially we're just looking at older adults, and we're not, we're not just advocating for older adults, but older adults, it's on average 750 older adults land in the hospital every day in the United States because of medications. So there are millions and millions of issues that go on in regards to adverse events. And if we don't take care of them, or listen, I think listening is such a huge issue. I mentioned a little bit earlier before we got started today that I was an advocate today, as many of us are, advocating for my mom. And I was talking with someone who's specializing in endocrinology, and it was a great conversation that we had in regards to how my mom is feeling and what we're seeing, and after injury and being laid up, moving more, and how that changes how she's responding to certain medical issues that she has. So, and I thanked him at the end. I'm like, thank you so much for having a conversation, right? So I think that if we listen to our patients or listen to those who are advocating and welcome that information, it fills in a lot of the holes that we might not be seeing, whether it be timing of medications, or Sylvia, like you're saying, even what's compounded or what is in a medication. I have had people through the years say to me, I can't take this generic. It doesn't agree with me. And, oh, well, it should be fine. But I always listened to that, and I would say, okay, let's talk about this some more. And we'd try to figure it out. So I think that is really important, that, whoever is advocating or whoever we're talking things through with, who's making decisions or trying to be the force in the healthcare area to make the changes, I think that it's so important that we're received by listening and communicating together, not just like, oh, forget it, don't have to worry about it at all. So I do think that that's really important. So and of course, going to a compounding pharmacy is wonderful. That's that's great. If that's where your needs are, to have
Mhm.
that available, I think is wonderful.
With those needs kind of being available, do you feel like, Sylvia, that you were addressing needs in the community today? And how is it going so far?
And I apologize, I couldn't hear the first part. You said address it. Can you say it one more time?
Donna was talking about addressing needs kind of related to compounding pharmacists addressing your needs. And I was
Yes.
wondering, we were talking kind of offline. When you're looking at the community that you're serving, how are you specifically trying to address their needs, and how is that going so far?
So are you referring just to the pharmacy side?
No, just in general, the
Just
patient
in general?
advocacy
Okay.
side.
Okay.
You're doing
So yeah, so in general, again, I have two sides to what I do in my particular practice. One side is the complex side, chronic, and then I have the side that could be somebody living alone, could be a senior. You don't have to be a senior, but what I address on the complex side is someone who's been running from doctor to doctor and hasn't gotten answers. So how I address that is through an in-depth assessment that I developed. So it's designed to identify areas that have been overlooked due to the time constraints in the average doctor's appointment. Because we all know that that's going on, that they're being forced to see 60 patients a day. And that's just not going to cut it when you have somebody who is complex. I mean, it's just not. You're not going to get a diagnosis. It's just not going to happen, or you're going to get misdiagnosis. So that's where I help my clients who are complex on that side. That's a critical part of my process when they come to me and say, I am so tired. I've been to 20 doctors. I've been sick for 3 years, 5 years. On the other side, with the individuals who are alone, or it could be someone who has adult children living in another state, and they can't be here to help their parent or loved one, help navigate the healthcare system. And so I fill in that gap, preparing for appointments for them, attending appointments, whether it's in person or virtually, because I can help people in other states. So, I'm their voice. And again, part of that is looking at their history, both complex and, someone who's not necessarily complex. Looking at that pharmacy history is critical. So I have uncovered things in the past. I'm not a pharmacist. I can't diagnose, treat, or provide medical advice. But just knowing that, wait a minute, okay, this person's been on this seizure med for 25 years. And yes, it was needed, but all of a sudden they're in a hospital because they're having all these, weird things going on. And that's the one thing that should have been looked at in the ER. But guess what? They didn't look at it. So this is the kind of stuff that happens, as you know.
Yeah, I feel like, Donna, the need is just so apparent, right? I mean, for folks that have worked in a hospital setting, especially, like if you've worked in a hospital and you have had struggles discharging a patient because they cannot get a ride home, then like how broken our system is. You recognize that there are a ton of hurdles that our patients have to go through that we don't even anticipate because we're so algorithmically focused when they're inside of our care setting. And I think there's a really great reason why we need advocacy. So the things that, we were talking about offline was, advocates can be put in place, Sylvia, if they are working for the hospital system, or they're working for an insurer, or potentially an employer, or they're independently kind of working in the advocacy world. We're seeing big pushes right now from CMS to get not just the social worker aspects, which, we've seen traditionally they're the advocates upon discharge. Sometimes we see nurse advocates upon discharge, but now having the CHW or the community health worker be emphasized inside of CMS legislation is a really interesting kind of step. So from your perspective, not global perspective, but just what you've done thus far, what's the state of payment and accessibility for patients to get a patient advocate?
So first of all, I'm glad you brought up the fact that, when we look at hospital advocates, they are employed by the hospital. So their allegiance is to the hospital and the risk management department. And the average person doesn't realize, they do offer a certain level of services that are valuable, and of course, patient safety is very important. We're having National Patient Safety Day. I think it was today or yesterday. But at the end of the day, though, the advocate employed by the health insurance company or the hospital, their allegiance is not to the patient. So as an independent advocate, my allegiance is 100% to my patient or client. That is where my allegiance is. So that's important for people to know, because, if people say, hey, aren't your services covered by insurance? And I explain, no, they're not. But let me explain why. And this is why, and when I explain why, someone who really needs my services goes, okay, that makes sense, because you're going to work for me. I don't report to a health insurance company. I don't report to risk management department. So that's really important to know. And then on the other side, someone who is working, who is working for an employer, and they have, you have your benefits, your health insurance, and all your benefits package. In some cases, if you have a health savings account, your health savings account, you might be able to use it to cover the services of an independent patient advocate like myself, as long as they're medical related or health related. And I always tell my clients, if I ask them a question, do you have a health savings account? If they say yes, I direct them to go to their HR director, their benefits administrator. It might be the owner of the company, whoever's, overseeing that. And then they can explore that. And then, I have a client that actually have a client in North Carolina who used his health savings account to pay for my services.
That's awesome.
Awesome. I know that talking Sylvia we have Andrea Leschak. She does a wonderful job. She's a pharmacist and a patient advocate. And she talks about the exact same thing you just talked about right there when it comes to putting on a different hat. Like the perspective you're looking at or the lens you're looking through is different when you're a healthcare provider versus providing the best care for a patient, which sounds contradictory, but it really shouldn't be, Sylvia, but we all know it is. So saying all of that, where do you feel like is the greatest mesh points for pharmacists and patient advocacy today? Like, where do you see the gaps, and where do you think we can start filling some things in?
Well, I think I mentioned earlier, I just think that, as an advocate, and I speak for probably most of the advocates who I know that are, independent. I mean, they look at the pharmacist as a valuable resource. So, if they have a client, and again, they have a medication list, or they're navigating their client to a physician or in a hospital. I mean, if they have a question, they know, hey, I'm going to pick up the phone and I'm going to talk to a pharmacist about this. I am not going to just take, I'm not trying to criticize physicians, because again, it's not their expertise, but just they're not going to take that verbatim, like, okay, these 5 or 10 medications are fine for this person to take. They're going to question it, especially if they see obvious, unusual behavior or symptoms, or the person's had a fall, if they're having cognitive issues, all these things have to be ruled out. Everything's a ruling out, right? And so I think that's where an advocate can work closely with a pharmacist, develop these strong relationships, because pharmacists are advocates. I mean, really, everybody in the healthcare field is an advocate, but pharmacists are so valuable. And I don't think that the average person realizes, a lot of people rely upon their doctor. They think that their doctor knows. And then they get mad if they have a reaction to a medication. They get mad at the doctor. But what they don't realize is that the pharmacist is that key person that you need to go to, that you need to talk to. And so I think, though, that if that makes sense, what I just said, I just feel that it's a very strong, connection to have on your team as a patient, independent patient advocate. You want that person on that pharmacist, whether it's compounder or conventional, you want a knowledgeable pharmacist on your team with you to collaborate for your client.
I have to call out here, Sylvia. Every national organization, if you are listening to what Donna and I are doing right now and what Sylvia just said, you need to record that right there, that snippet, and blast that out, because payers, healthcare organizations, and future CMS documentation and policies need to start incorporating some things that Sylvia just acknowledged from the professions. I can't thank you more, Sylvia. Like it feels very validating, I think, for us as pharmacists to go, it's so nice to see someone that's been advocating for themselves, their family members, and their patients and clients recognize that, there's some specializations right throughout healthcare, and we have different skills and abilities. But incorporating a pharmacist into the flow of things is essential. I mean, you have pharmacologists that specialize as drug experts. And a lot of times, like you said, it's not the fault of the physician or the nurse or whoever the care provider is. It's truly not within their scope or specialty the way that's in a pharmacist. So that's amazing. What things do you think we can do better though, Sylvia, when it comes to pharmacists kind of making sure that we are playing that advocacy role? And how can we get in contact with a patient advocate if we feel like there's additional services that are necessary, for our patients to have on board?
Well, one thing I can think of, but it may involve more of a systems issue because again, we have so many multiple systems. If you get your prescriptions from 3 different pharmacies, whether one could be compounded, 2 might not be, is again, I think this is more a systems issue. It's not necessarily the pharmacist's fault, but just again, you can't, you can ask a patient, give me your medications, like tell me your medications, and they may forget. That's why you need that advocate, right? Because that advocate is the person who will start with you from the get-go. That they start with you, and I say my model is I want to be proactive with my senior clients so they don't end up in the hospital. I don't want all of a sudden to get a call that I'm in the hospital. No, let's be proactive. So I think that that in that area, I don't know what the answer is. When you have, go ahead, Kevin.
No, I think you said it perfectly. I think there's just it's a difficult situation where we just have to have more automated solutions that connect multiple players inside of the loop. It's just way too often that it's fractured and no one can do their jobs, when we have a fractured system like that.
Right. And then on the other part of the question, as far as other advocates, so we have 3 national organizations or alliances where we have independent advocates who are members. One of them is the National Association of Healthcare Advocacy. That's one of the largest. We also have Greater National Advocates, who's actually started by a gentleman who actually he himself has an incredible story. His name's Brad. And then we have the Alliance of Professional Health Advocates, APHA, which was started in 2009. And so those are probably the top 3 for individuals who are independent advocates, who are members, who they obtain education and networking. So those are the 3. So if somebody were out there saying, hey, I'm looking for an advocate, I'm looking for a patient advocate who's independent, you could go to any 3 of those, and there are directories where you can look at someone by state or specialty.
Yeah, that's great.
Amazing. Now, Donna, have you worked with advocates in the past, or have you had the pleasure to do so?
I really can't say I have. And this is what's been intriguing to me. I've been learning more and more about advocates. And then, of course, pharmacy advocates, I'm speaking with them. What I've worked mostly with is the social workers and like the nurse caregivers, especially at the hospital. So I can appreciate what Sylvia's saying because we attend rounds, right? And it's when what's the plan for discharge for this patient, and I teach my students, like when they go to these rounds, like that's what the conversation is. It seems weird at first when you're there, like, how do we discharge? How do we get this person better to discharge? It's like, and we're always thinking of that. So I can see where you're coming from, Sylvia, in that, that is really their purview, and their job is to make certain that they can be discharged in hopefully as healthy of a way as possible. Like what's best for this patient, home or, short-term care, whatever it might be. But working with advocates, I can say a lot of the folks that I've done medication reviews for, I've worked with their personal advocate, whether it be a spouse or a parent or somebody. So in that regard, I've worked for advocates that way. But to have an independent advocate who might not be related to somebody and to work together with them, it's like my head's exploding talking about all of this. I've written down so many words that I have actually either used or, I can see as really coming together. So one of the things I think is really important, if you don't mind if I take a moment for this, is, Sylvia, you talked about it's a process that we need to work with our patients with. And I say that all the time about deprescribing too, right? So here's this process, and how great would it be to have an advocate as somebody else on that same page, in just making certain that, okay, we've been successful and we've deprescribed this. What's next? Because we can't just deprescribe everything at once. And in order to maybe have that work between the pharmacist, the patient, and the provider, however it might go, having an advocate on board would just be priceless in that regard. So I think that that's something that's really important. You also mentioned like this whole preventative and proactive approach to things. How many times have I said that, right? Or have we said it, that, we don't want to wait for the fall. We don't want to wait for the hospitalization, the toxicity, the interaction. So let's be preventative and proactive so that we're keeping people healthy and upright. This week is National Falls Prevention Week, so in awareness. So we want to make certain that we are preventing falls. So what's a better way than to find an advocate, find a pharmacist, find one of each.
Yes.
And let's stay upright, right?
Absolutely.
Healthy and proactive.
You're spot on.
So yeah, so really, really important things. And then, it really is a system. It's a healthcare system that is not necessarily working super well. And, we have some great people here and great connections that, why not? Let's see how this works, right? Let's empower advocates. Let's empower pharmacists to do this wonderful work that we're talking about.
If I could say one thing real quick, I just thought about it. I will tell you that my client who I helped recently, who navigated here from another state, I will tell you that the specialist who I brought him to, who's one of the top specialists in the country, spent 3 hours with my client. But the other part is that when he looked at me, he didn't know who I was, what I did. And he looked at me and I had my name badge on, my company badge. He said, "What do you do? What do you do?" And I said, I'm his patient advocate. And he said, "Oh," he's like, "Oh, you're here to learn?" Oh, and after that, the engagement level was through the roof. I'm going to tell you that the engagement level between physician and patient and advocate, just actually this client has seen 2 physicians so far with me. Engagement level was just way, way up. And they're both excellent in their field. Obviously, these physicians are both excellent in their field. But I think people don't realize that when you have someone in the room who's prepared, who is there to collaborate, and that helps the physician. It helps the physician because you've come prepared and you have the questions, and then you know what I mean. So that's where people don't realize that their appointment could go a completely different direction. If they're in there by themselves and they don't really know what to ask, or they're afraid to, they're intimidated. So I just wanted to point that out.
No, I think that's so well said. And I think it's interesting that you point that out, because that was the last kind of remark I had, Sylvia, is just related to, as we're seeing payment models change relatively rapidly, Medicare Advantage especially, that we're seeing more and more value-based care aspects, that the less we can spend on a patient and their readmissions, the better. And so I think a perfectly positioned going to be patient advocates and or CHWs, these community health workers, that I've seen some folks talk about how great pharmacy technicians would be in that role. And I can't agree more. I think there are a lot of individuals that can play a massive role there. They don't have to come from a clinical background. I think you're a perfect example, Sylvia, that you've gained a ton of clinical knowledge and community knowledge of what resources are available and how does someone navigate something, especially inside of the space. And so I really think it comes to having administrators think differently about some of the programs and payable things they have in space. And so being able to leverage transitional care management and or TCM programs and say, who'd be great here is if we actually grabbed a independent patient advocacy group to help us with our TCM programs so they're truly successful, post-discharge. And anyway, just wanted to give huge kudos there, Sylvia. I think the work that you're doing is fantastic. I love that it comes from such a beautiful spot for you. And I did see that, we had another individual pop in here. Thank you so much. So awesome for being the patient advocacy that you're offering there, Sylvia. So thank you so much. Audience has been there and asked any questions that you had. If you have more, please hit up Sylvia on LinkedIn. She's streamed across her audience. Send us any information or questions to our PH Ally and keep coming back to the Deprescribing show. We sure enjoy seeing you guys and your participation. Any takeaway words, Donna and Sylvia? I'll leave it to you guys.
Yeah. So, Sylvia, thank you so much for joining me. I think it's really important that we continue to work together. And part of the whole point of this, RPH Ally and the Deprescribing show is to make certain that people are aware, that pharmacists know that we have team members out there. We have folks that are, side by side wanting to advocate with us. So thank you so much for being that person and highlighting this with me. I think it's really important that all the pharmacists out there see this niche as being a really wonderful start of a great team.
Well, I just want to say thank you, Kevin and Donna, and all the pharmacists out there. Every pharmacist, I applaud you because I know you guys are so valuable. You're such a tremendous resource. And, when I first got connected with a lot of the pharmacists on LinkedIn, it was through a pharmacist who had become a coach. And then next thing I know, I started connecting all these pharmacists. I said, I love you guys. I've loved you guys for years, but now I'm like, this is great that I'm connecting with all of you on LinkedIn. So I have, pharmacists all over the country on my LinkedIn. But thank you so much, all the pharmacists out there. I applaud you. I know how hard you work, and I greatly appreciate it.
And with those words making Donna and I both blush, thank you so much, Sylvia, for and we're to keep pushing forward with pharmacy and advocacy together. Have a good rest of the day, everybody. Anything else, hit us up on LinkedIn. We'll talk to you soon.
Absolutely.
Absolutely. Thank you.